distinguished guests, we now move from policy to implementation to a conversation among service provision leaders for those who are often the most vulnerable and the least visible, our children. At this juncture, I'd like to hand over to Dr. Ilona Kickbush to chair this discussion. Ilona.
Ladies and gentlemen, it's very difficult to do an opening without speeches, but, and you've had those. We thought we would add a conversation as well. And as you just heard from our moderator, it's a conversation with people who are out there, who experience some of the toughest issues that we face, particularly in relation to children. And I would like them to join me here on stage, two fantastic women leaders, Inger Ashing, the CEO of Save the Children International, and Helga Mutasingwa, who is the youth representative, founder and CEO of Afya Pamoja from Tanzania. Please come and join me. Thank you very much. We're providing a bit of a counterbalance, as you can see. And we would like to say, what does health, taking global health to a new level, mean in terms of the health of the next generation? We're very happy that there are many youth leaders also here in the audience, and that some of the sessions also take up the issue of children. And of course, the polio pledge that we have already spoken about is significantly about children and their future. But I'd like to turn to Ms. Ashing, to Inger, and ask her, infectious diseases obviously are enormous challenges to children. Many of them die. But your experience is that it goes so far beyond that, and that you work really in the hardest to reach places for children, with children. There it is really toughest to be a child, as you say. So what role does health play in your work? How do we bring these issues together if we really want to have a future for children?
Thank you so much for that question, and I want to start by saying that, in my opinion, and the opinion of many others, we are actually witnessing one of the worst child rights crises that we've seen. Progress of decades of progress in many areas, including health, has been halted or actually worsened due to a number of situations that children have faced, COVID-19 being one of them, but we have more conflicts in the world than ever before. We have climate change and also a more and more discussed the cost of living crisis. So I think on all levels, children of today is witnessing and experiencing a much more difficult situation. And as a global child rights organization and the largest independent child rights organization, of course, ensuring that all children have the opportunity to thrive, to grow up healthy, to have access to education, to be safe, is a very big part of our mandate. And we do that in working in close collaboration and partnership with children themselves and with local organizations in many of the countries where we work. We did a survey a while back where we asked children themselves and also their caregivers on how COVID had impacted their lives. And 89% of them said that due to COVID, they had limited access to healthcare, which of course had a lot of negative implications. Routine immunization didn't happen, treatment of severely malnourished children isn't happening. So we see a lot of challenges right now. And as we also heard the Secretary General speaking about, the mental health is an increasingly it's an increasing crisis among children. I want to say something about the climate-related shocks, because we do see them happening around us. Earlier tonight we heard about the situation in Pakistan. We have droughts, we have cyclones, we have heat waves, and they all pose dangerous threats to children's health. Lack of water, sanitation, hygiene services make them more vulnerable to treatable diseases, diseases that we normally can handle, and that with the current situation where we're leaving children on their own without proper access to treatment. And the final thing I want to say to this question is that the global hunger and malnutrition crisis is seriously affecting children. Child mortality is rising dramatically, and we also see that in combination with diseases that we can't treat, not being treated, is a real risk. We saw it in Somalia in 2011. We're seeing it in the Horn of Africa right now. I spoke to my team who is working in Somalia a while back, and we are currently trying to, with a lot of other partners, try to save the lives of the more than 500,000 children that are at the acute risk of dying right now. And one woman, she came to one of our health facilities with one of her children. She had 3 sick children. She could only carry one. And that is not a choice any parent should have to make, but that is what life looks like today, and that is the challenge that children and their families are facing.
Thank you, Inga, and thank you. Thank you for drawing attention to what's sometimes called the forgotten crises. And we know also that Dr. Tedros from WHO very significantly always draws attention to those crises that have been with us, it seems, forever, that we have not been able to resolve, and that therefore move out of the news cycle and mean very dire situations for the people involved. Helga, your organization obviously works to advocate for health, for the health of the future, and we've seen the many young people that are here, and we see the concern of young people that in some cases are turning to quite radical means to be listened to. So Helga, are you listened to? Everybody says, you know, you can't do a panel without a youth representative anymore. You have to have youth representatives at your meetings. So I think that's a fantastic development, but I'm an old women's advocate, you know, and there were times when we were there, but we weren't listened to. So what feeling do you have? What do you think has to be done?
That's interesting for a young person to be asked that question, and I'll respond as it is. There is an initiative of listening, but I'm sad to say that we are not being listened enough. And that is the sense that if not every young person of any background in any institution or government system is being listened to, or the action is being taken from what they have voiced up, then it's not enough. But I think for the initiative, we need to continue. And as I've been introduced, my organization that I'm working with, Afya Pamoja, which is Health Together in Swahili, we're working with the Ministry of Health and the Ministry of the President's Office, Regional Administration and Local Government Authorities to make sure that the voices of the citizens in healthcare system are being listened to. And this is through the mobile phones feedback after receiving the services. And why mobile phones, why the existing digital platform in the government system itself, so that the healthcare provider from the primary healthcare level to the tertiary level, they are able to see on timely basis the response so that they can improve the quality of healthcare services. I'm here also as the youth board representative of the Global Youth Mobilization, whereby the big 6 youth organizations in the world, in support of WHO and the UN Foundation, were able to have funds that were taken, the funds were able to be put into the hands of young people in over 70 countries, and over 140 projects were led by the young people during the COVID-19 pandemic, which is still happening. And we hope these young people still continue to support their communities even after this pandemic. And the areas that young people that have been able to work on is on the gender inequality, mental health, vaccine inequity, education disruption, and employment. So all health, all effects that were that happened due to COVID-19, young people were affected. And through their own communities, with the support of WHO and UN Foundation, these young people have continued to do amazing things with the funds that we were able to receive. Thank you.
So thank you for highlighting this notion of leadership of young people, and particularly if they are empowered also. Actually, in a project that I'm running, the young people said I was not allowed to use the word empowerment anymore, but I'm a speaker of enfranchisement, and meaning really that you do have power, that you take it, and that you take your rights forward. So, Inge, you know, very frequently when we think about humanitarian situations, we think of the people in those situations as victims. At the same time, they have to develop enormous strength to actually live through those situations. And you said, you know, this example of the mother that you gave, those enormously difficult choices that they need to make. So in that context, if we talk about who needs to act, you know, what is possible in that context? It's not just about bringing money, it's not just about bringing food. What is it that your organization really wants to achieve in terms perhaps also of this enfranchisement?
Yeah, thank you, and thank you for that great example. I'm so proud of, there's so many great youth movements around the world and we need to support them. But I think the start of your question is maybe, in my view, the most important one, and that is that we are not talking about victims, we are talking about people with a lot of agency, a lot of strength. And I was in Afghanistan 2 months ago, and I met a number of young girls who are being robbed of their education, robbed of their future. But the resilience in this group of girls, the commitment to be part of a positive change, that is what keeps me going. That is what makes me think it is possible, because there's so incredibly strong and resilient people around the world that needs the right help and the right support to be able to turn their own situation around, to turn their own countries around, their own communities around. So focusing on local partners, local children themselves is really, really critical. But we cannot leave them on their own, because things will not change unless we step forward and support them. And we've heard a lot of speakers before us earlier tonight talk about the need for a more equitable global health order, a new global approach to health. We heard Ms. Galina and Dr. Tredus saying that, and I think that is so important, because if we don't have the political leadership, the political will, but also the financial commitments, because to be honest, if we talk about the humanitarian situation in the world, we see the number of pledges going up and the financial contribution to the pledges percentage-wise going down. But 2 areas that I want to address specifically, and one is that we need to invest in early warning and anticipatory action, and we need to do that now, because we need to prevent the crises before they happen. And we heard it from Chancellor Scholz saying as well, preparedness matter. And we heard from Dr. Tedros as well that it is about promotion, it's about prevention. And we know that that works, so that's where we need to focus. But we also need to address the root causes of many of the situations and the crises we are part of. So in my view and in my organization's view, it's all about investing in building resilience systems, but also working to support the health and educational systems, because I do think it's important to have a holistic approach. We had a lot of other people saying that. So that's what I would say. It is important to ensure that we help governments invest in children's health. And I think that there's a very important conversation to be held about debt and debt relief, also about securing climate financing that works for children. and also to ensure that we have the ODA, the aid that is needed. But working together is critical. I want to just end this with a message from a couple of children that we spoke to about what needs to be done differently.
Can we do that in the next round?
Yes.
So,
Okay.
Yeah. I'd like to turn to Helga, because you spoke about Afghanistan, you spoke about women and girls. And of course, this is one thing that we're experiencing. You know, we've experienced on the one hand the contraction of civil society space, and we have experienced a lack of support to sexual and reproductive health and rights. We're experiencing a rollback on women's rights and girls' rights. We have the situation in Iran that has erupted. So in terms of your activities, Helga, how much are you involved, touched by this? How do you take this forward when these dire situations happen in some of the countries where young people, young women in particular, are fighting for their rights?
That's a good question. I just got reminded yesterday, actually, first of all, that girls and young women, or women in general, they are vulnerable. But then we need to remember that girls and women who have disability are worse than that. So we need to really think about, as we were thinking about this vulnerable group, those with disabilities, it gets to be very, very worse than that. And the girls and women are experts of their own lives. And I would really like to insist on this, that decisions are not supposed to be made for themselves. No matter how old this girl is, they are experts. And you can see I'm wearing a scarf, I'm a girl guide. And representing the big 6 youth organizations, we are champions of non-formal education. This gets to be the platform whereby young people as girl guides, the programs or the activities that gets to be created to solve the problem are developed by consulting the girls and women themselves. So that means they get to be considered, and they get to be led into supporting the communities, into speaking about the problems, but also on how to lead in solving these problems. I have an example of a program we have on the girl-powered nutrition, but as an expert, it might be spoken in very much technical words. But we have a program whereby girls from the age of 3 to above, they understand things about iron deficiency, anemia, and then they get to learn on how they get to solve these problems, on how they get to engage their community leaders, on how they get to engage their families to speak about this. What is the best meals to have? How do we have a garden? So this is the basic thing that gets to be developed by the conversation, by the safe space of education and knowledge sharing. You don't need to be an expert to champion for something that is very important in your community, or it's very important about your life. Thank you.
Thank you very much. So we have to bring this short conversation to a close, but I'd like to give each of you an opportunity. You have this enormous audience here of committed people in global health. What is the one message you want to leave with them in relation to the health and the rights of children? Did you start, Inga? One message.
Yes, so then I will quote the children we spoke to. And I think, as Helga said, we cannot do anything without them. So I think that is my main message to you. But their message to you is, look beyond national interest, work in partnerships, draw inspiration from innovation, take responsibility, and act with urgency.
Act with urgency. What would you add, Helga?
I would request for a meaningful engagement of young people in the healthcare system. We are experts, we live the experience, and through the global youth mobilization, we have seen the impact that has been brought by young people. So invest in young people with meaningful engagement. Thank you.
Thank you very much. Thank you.